Pattaya City Expats Club is a non-profit social organisation and our speakers are volunteers. The club as such assumes no responsibility or liability for the professional reputation of or the quality of services provided by the speaker today.
Okay, this Sunday speakers, excuse me, we have two doctors from Bangkok Pattaya. One is Dr. Natchai and the other is Dr. Tanakorn. Now, Dr. Tanakorn is a neurologist, and basically he will be saying to you what happens when you have a stroke. And coincidentally with this, we have Dr. Tanakorn, who is, I don't know how I describe him, he's a rehabilitation specialist, yes? Okay, and he will say, how do you rehabilitate from a stroke when you've had one? So it's two doctors telling you what to do if you have a stroke, and secondly, what to do, how to recover from it. So I'd like to give them both, please, a very warm PCEC welcome.
Okay, thank you for a warm introduction for myself. Oh, yes. Well, this is my first time to be taught in the public, especially in the international class like this, and it's a little bit nervous for me. So if anything wrong, I have to apologize at the first place. Okay, before we go into the topic, I'd like you to see a short clip video about the stroke. What happened, and now, what are we going to do?
Stroke is a leading cause of disability in America and the number 4 cause of death.
Stroke affects millions of Americans and their loved ones each year.
For 80% of strokes are preventable.
Yes, stroke is preventable, treatable, and beatable.
And together with the American Heart Association and the American Stroke Association,
We have the power to end stroke. Together, we can prevent stroke.
As we continue to work with the world's leading health experts
To innovate ways to prevent stroke.
Each of us can take simple steps to reduce our own risk.
Like exercising,
Eating healthier,
And having your blood pressure checked regularly.
Together, we can treat stroke. We're studying the risks and causes of stroke to develop treatments, programs, and practices, including teaching hospitals how to better handle stroke emergencies and
educating people on the warning signs of stroke.
so we're all better prepared to act fast.
and save lives.
Together, we can beat stroke.
What's good for the heart is good for the brain.
that's why we support brain health research that educates, advocates, and builds connections.
That have a positive impact on our communities and neighborhoods.
And because of that support, stroke survivors and their families
Are not alone in their recovery.
We're able to rebuild happy and fulfilling lives.
By working together,
We're working towards a day when stroke.
Doesn't take a life every 4 minutes.
The power is yours.
Mine, ours.
Together.
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 Together, we can end stroke.
Learn more at strokeassociation.org.
Okay. All right, so the previous clip is a short clip that summarizes everything that I'm going to talk today. 1 minute clip. So now, in this year, in May, is will be American Stroke Month. So I have to talk to you first. I have to based on American association, so because mostly of the Thai of the healthcare in our country, we learn and we develop from the mostly from America. So many information that we reference and many of the data that we collect will be from mostly from America. Okay, so my topic today is about the stroke 101. I think most of you maybe get a little bit confused what 101 is. It's just like a fundamental class of the stroke. So today we're going to talk about what stroke is, like what is the rate of stroke, what type of stroke is, and how can we prevent, and what are we going to treat when stroke is occurred. So today's outline is about the, as I told, is what is stroke, about the stroke, the fact of stroke nowadays, type of stroke, cause of one, and what is the TIA or the transient ischemic attack, the risk of stroke, and how to view the risk in the warning sign of stroke and up-to-date treatment of stroke. So, what stroke is? Most of you may be familiar with the heart attack, right? Because it's very fatal and it's very dangerous disease. Stroke is the same because the stroke is also the disease that occurred in the vessel, the same as the heart. So we call that stroke is a brain attack. So which is the condition that brain injury occurred, where the blood vessels is become blocked or it's got burst, cutting off. So when the blood vessels it cannot go to your brain, it will make your brain cut off of the oxygen and it will make your brain cell dead. So now from the scientific evidence, we found that about 2 million brain cells die every minute of the lack of the blood supply. And so how can we categorize stroke? We have two types of stroke. The first one is the ischemic stroke, or is like the blood vessel is blocked. So it's caused by something occluded to your vessels and cannot let the blood supply to the area beyond that blockage. The other one is what hemorrhagic stroke. So that's like the bleeding, or that's when your blood vessel has got injury or is burst. It can cause your blood leak out of the vessel and can damage to the peripheral brain tissue. But mostly of the stroke is caused by the blockage. About 87% is the ischemic stroke, and about the rest of the 13% is caused by the hemorrhagic stroke. So, what is the fact of the stroke, and why it's so important? Why we have to talk about this today? Because nowadays, globally, about 80 million people have got a stroke, and about 13.7 million people have got a new stroke each year. So that's been one of the 4 people over 35 years old, they got a stroke. And almost 5.5 million people die of stroke annually. And so this is the second cause of death in the world. And the ischemic stroke, as I told before, is the most cause of the stroke, that cover 80% of the all type of stroke. And this one is a type that you can prevent. So, but the brief slide is about the godly information, and because I know that most of you are from the US, right? So this is the fact about the stroke situations in the USA. In the US, about 800,000 people have stroke every year, and almost 3 or 4 at the first time of the stroke. And stroke is the 5th cause of death in America. So, and that's be like almost 1,400 of people die a year. So that's like approximately like every 4 minutes, someone dies from stroke in America. And from the information, mostly of the risk is come from women have more risk than men because, yes, as an underline, because women live longer. So when you live longer, so you have more risk of stroke, of course. And approximately 10% of stroke occur in the individual age of 18 to 50 years of age. So this stroke is not just happening to the old age; it can be happening to any age. And what is the burden of the stroke? The estimated total cost of stroke and indirect stroke in the US, it will cost you about $1 billion a year. So that's like all the cause of stroke that can be affect to the economic system. in the country, it has a big effect on that. So that's why stroke is going to be like a very important topic issue in every corner in the world. And stroke is one of the causes of death that can be preventable. So that's like if you know about what is the rate of stroke and what is the cause of stroke, and you know how to prevent the stroke, so that's like you can end the stroke. Okay, today I'm going to focus on the ischemic stroke because the ischemic stroke, or the cut off the blood supply to the brain, is the majority of the stroke type. About 80% of stroke type come from this cause. So what can cause your blood vessel blockage? It can cause from two situations. At first, it's caused by your blood vessel got thicker of the wall by the deposit of the fat, and it's just like gradually just to occlude until one day, bang, it's totally occlude. So that's mean like you got a stroke. This is the first cause, and the second one is caused by some of the clot from anywhere else in your body. It bursts out and it's going through the blood vessel and occlude to the blood vessel in your brain. We call that like the thrombus. Sorry. The thrombus or the thrombosis is the blood clot formed in the artery, just like this. This is the first cause, and the second one is we call that embolus. So that the clot from anywhere else of the body goes through and occlude to the blood vessel of the brain. And the other cause of stroke is the hemorrhagic stroke. The hemorrhagic stroke is the minority.
Just hold on.
Yes, it's a stroke.
Yeah.
Yeah, it's like contract attack. So, okay. The bleeding in the brain of the hemorrhagic stroke is the minority of the stroke type, which causes about 13% of stroke. It's mostly caused by two causes of the disease can cause the bleeding in the brain. One, first of all, is the aneurysms, or it's like the swelling of your blood vessel wall, and it become so. Here is this is normal artery, and if your vessel wall is weakened, so it cannot tolerate the pressure from your blood. So and it will be swollen out just like a balloon. Until it bursts out. So we call this is aneurysm. This can cause a bleeding in the brain. And the second one is caused by the malformation of your blood vessels. So that's mean like the artery and the vein, it join into in an anomaly pattern. So this can cause the bleeding easily. But this one usually will be the congenital defect, or it can be. It happens since your birth. All right. So now you know about the two types of stroke: the ischemic one, or the blockage of the artery, and the bleeding one. So this is the other spectrum of the stroke. We call that a TIA. So that's or it stands for a transient ischemic attack. So what is this? This syndrome is can vary, just like its name. So it's like your brain is cut off the blood supply, but it's temporary. So you got the symptoms, but you can be recovered by yourself within a day. So that's what we call that it's just like the warning sign of the stroke or a minor stroke. So you got the symptoms stroke, and then you recover by yourself. So we call that is transient. So it's transient ischemic attack. So, but nowadays, because this symptoms is so important as the stroke. So when you got these symptoms, not be going to your medical service immediately. because the TIA is also a medical emergency. And now we treat the TIA the same as the way we treat stroke. Okay, because one of the pitfalls for many patients who got the TIA, and because they get recovered by themselves, so they think it's maybe not something dangerously, or it maybe not needs to be so worried about, and they didn't come to medical service, and when time passed, they finally got a stroke. So this is the thing that I wanted to concern to you guys all that. If you have the symptoms just like a stroke, and although it recovered by itself, okay, not to be so calm, be alert and go to your medical service. Okay. All right. So, and now what is the rate of stroke? As I told you, the 80% of the first stroke is preventable. And one of the most risks of the stroke is the high blood pressure. High blood pressure is the most common controllable risk of stroke. The other one is the atrial fibrillation, or stimulate your heartbeat in a regular rhythm. So this can cause the stroke when your heartbeat is not beat in the regular rhythm. It can cause a clot inside your heart chamber, and one day if the clot bursts out, it can cause the small clot to occlude to your blood vessel. So if you've got a rhythmic of the heartbeat, you can gain a risk of the stroke about 5 times when compared to the one who didn't have. Okay, and stroke rate is 2 to 4 times higher among the smoker. Anyone here smoke? Give me your hand. Okay. Are you sure? You never smoke?
I'm not going to tell you.
Okay. All right. I'm just going to show you that. If now you're a smoker, quit it. Stop smoking, and you will reduce the rate of stroke. And it's not just only it's not just the first-hand smoker, also the second-hand smoker also. All right. So if you don't want to be okay,
come back.
He smokes.
Okay, maybe the computer smoke. All right. Okay. And the other one is the history of the stroke in your family member. If you got your family member, your family member who got a stroke, especially your first degree member, it will increase the risk of you about 12%. So that's related to stroke, because many of the risk factors that can cause a stroke, it can be inherited. Okay, and another one is about the eating salty. If you eat salty, you will get more salt into your body, and then it will cause the blood pressure to get more higher. And as we know, a high blood pressure can cause a stroke. So eat salty is also the risk of stroke. All right. So now when we talk about the risk of stroke, we can categorize the risks into 2 groups. The first one is the unchangeable risk. So what is unchangeable? So that you cannot change. Of course, your age. You cannot get younger, right? And gender. Okay, this is the physical gender. And okay, you just have a male, female. And you cannot change that in the biological way. Your family history, your race, and your history of the stroke or the prior heart attack or the vessel disease. So this is going to be unchangeable, so you cannot change anything on that. But this is the one that I want to emphasize that this is the changeable risk. And if you can reduce or cut off the risk, cut off all these risks, it can prevent you from so 80%. So what are these risks? The first one is high blood pressure, diabetes, your lipid profile, your obesity, smoking, and physical inactivity. Well, when I look around in this room, I think that most of you are on this one. Maybe on the obesity and physical inactivity. Am I right? Okay. So, and if you try, just you lose your weight, you stop smoking, and you do more exercise. Just only 3 things. You can get it off the 3 week of stroke. It's a very easy one. Okay. And how do we reduce? How do we reduce the rate of stroke? The American Heart Association and the American Stroke Association have issued this large symbol 7. So it's like a symbol 7 thing that you can do regularly, and then you can prevent a stroke or the heart attack. So it's obviously the first one is the don't smoke, control your blood pressure, consume less salt and eat more veggies, eat more vegetables and fruits. Lower your cholesterol, reducing your blood sugar, lose your weight, and do more exercise. This is just a 7 magically tools for you. If you can do it every day, of course, you can keep the stroke and the heart attack away. And now we are going to talk about the stroke warning signs. So how do we know that you got a stroke, or your friends, your families, or your loved one got a stroke? This is the warning sign. So as it underlines, everything or every sign should be happen steadily. So it's like a sudden weakness or numbness of one side of your face or your body, sudden confusion, trouble speaking, or speech difficulty, or hard to understanding the language. Suddenly trouble seeing on one side of your eyes. And sudden trouble walking, like you can sudden severe dizziness and loss of your balancing, or your coordination. And a sudden severe headache with unknown cause. The severe headache is there is some little detail on the to amplify the meaning of the severe headache. It should be like this: is the most trouble, is the worst headache in your life. Just like so, in the medical term, we have a term that we call a thunderclap headache. So this is going to be the sign of this. So this is the meaning of the severe headache. Okay, not just like a headache, and you may think about you got a stroke, but if you got the not so severe at that level. Okay. So, and now we try. So we make a mnemonic that make you more easily to remember. A beat fast. Mostly now we just use a beat fast, FAST, as a warning sign of stroke. You should remember and you should act quickly. But to make it more cover, I add 2 more letters, B and E. So be fast. B is the balancing, lose your balancing or you have a dizziness. E is for eye. If you have the blurred vision, double visions, or one blind, or loss of your vision in one eye. F is from the face. So one side of your face drooping. A is for your arm. It's like your arm with like weakness or numbness. And S is for speech. You got a speech difficulty, or including the inability to understand language. And T is the time, because time is very important to treat a stroke. As we know this now today, the time is brain. So that's like if you have a simple stroke, go to your nearest hospital as soon as possible, because the time treatment of the stroke, it will be not more than 6 hours when you got a severe symptoms occur. Okay, so this is the thing that I'd like you to remember and act quickly. Okay. So as a stroke awareness is a very big issue in every country, including the US and in Thailand, in every country, that how do we alert our populations, our citizens, to know about the stroke and to act correctly and quickly. because time loss is brain loss. So if you recognize someone who got a stroke warning signs, as I told you from the previous slide, get help immediately. Because stroke is medical emergency. Call for help. This is your chain. This is your survival chain. Okay, it's 911 Thailand. We can call the 1719 to our hospital. And okay, we got the treatment as quick as you call. Okay. And now for the treatment of stroke. How can we treat it? So when you got one. The treatment of stroke we have can divide into two phases. The first phase is if you have a stroke within a 4.5 hours from the onset, you will be able to give the thrombolysis or the dissolving agent inject to your brain, and it will dissolve the clot inside the brain. So this is the first treatment if you come within 4.5 hours from the onset of stroke. But if you come later, but not later than 6 hours, we still have the other treatment. We call that a medical thrombectomy. So that's when we insert the catheter through your thigh directly to the site of occlusion, and then we use this small device to trap on the clot and drag it out. So this is the up-to-date treatment of the stroke nowadays, but it still be count on time. The first treatment within 4.5 hours, and the second treatment is within 6 hours. Okay. And what about the rate of stroke recovery? The prognosis of stroke is just it's just at the number that's okay. I'm gonna get you to it. Okay. 10% of stroke patients die. 10% of stroke survivors recover completely. 25% recover with a minor impairment. 40% experience a moderate to severe impairment requiring special care. 10% maybe need a nursing home or have a long-term care facility. And 15% die shortly after stroke. But you can see that mostly of the patients, more than 50%, they can survive and they can live. They can be back and live just like the past. Maybe just a few residual symptoms left, but it's not cost to you in a major date. If you come on time, if you come in time, and the treatment was given so as quick as possible. Okay. So and this is just like the introduction to the next section. So that's we're going to tell you about it. How do we recover, or how do we do when you got a stroke and you already treated a stroke, but you still have the disability left. So this is the phase of recovery. The rehabilitation is going to be the answer. Because the rehabilitation is the key to recover after stroke, and if you can perform, or you can get into the rehabilitation center that have a sophisticated tool and has an experienced doctor, you can recover almost fully within 6 months. And how to perform on this? And what is the type of what is the kind of rehabilitation that we have? We have many. From the physical therapy, like walking and movement, occupational therapy, like taking care of yourself, speech language therapy for the person who got a speech difficulty, and the reincarnation therapy to make you can go back and perform your daily activity, just like cooking, gardening, like this. And how do we do? This will be, you can find the answer in the next section. Okay, so it's the take-home message. Today, after you go back home, I'd like you to remember these two slides. Be stroke smart. Reduce the stroke risks because now you know the stroke risks. Recognize your stroke symptoms and respond quickly. this is the quote that I like you to declare. Just like it, because I will not have a stroke, because stroke is preventable. If you can do to reduce the risk, you can prevent the stroke for 80%. So as the bullet on the first clip, together we can to end the stroke. Okay, thank you. Okay, and for the next sections, I would like to introduce my colleague, Dr. Natchai, who is the physical therapist, to tell you about how do we rehab, how do we train after you got a stroke. Please.
Good morning, everyone, and thank you for Dr. Tanakorn. Okay, shall I introduce myself? I'm not a physical therapist, I'm a physiatrist, rehabilitation doctors. Okay. Sometimes many people confused about this term. Okay. And after the session of the Dr. Tanakorn, how do you feel? I saw your face, it's very serious. How bad of stroke when it happened to me like that. Okay, because of the stroke is a very serious condition because of we don't know what is happening and how serious it happened. Okay, this topic I'm going to talk with you about how to improve. I have a good news that I have to tell you that the stroke can improve now. Okay, so now don't be serious. Okay. Okay, so I will remind you what happened after you have a stroke attack. So the main problem is like a weakness of the muscles. In the one side of the muscle on the left or the right. You maybe have some problem with speech. You have a slur of speech. It's difficult to find the proper word. It's difficult to speak. You maybe have a slow behavior and difficult to walk from the weakness. You're difficult to remember or decide to do something. Okay. And you maybe have some loss of sensory function. It's like this is an acute phase. It's like early phase after the stroke. But after that, in a few months, in a few weeks, 2 months, the symptom can be more developed, like a more problem like a stiffness of the joint. Your muscles after the stroke may be quite weak, but after that it's turned to be like a spastic. You cannot control the muscles. How of this problem is depend on the area of the stroke, depend on the area of the brain damage. So, okay. The next slide, I want to show you about ischemic pre-number. Dr. Tanakorn show you something about if you have occlusion of the arteries. The arteries supply the area. It's not all the brain, but it's supplied in some area of the brain. Depend on the branch, and if you have occlude in the big branch of the arteries, you have a damage in the bigger area. So, if the artery occlude in the area in the center is like a dead tissue, all the brain cells is dead completely, and so it cannot function at all. But around the dead tissues, we have like some cell is loss of blood supply, is loss of oxygen, loss of nutrition of the sugar, but it's still alive, not dead, not completely dead. And so the important that the first time that you come to the hospital after the stroke attack, Dr. Tanakorn and Neurologist try to preserve the brain tissue as much as we can. Okay, so but after that, after we preserve, still have some dead tissue and maybe have some disabilities. After that, what we do. Okay, and sorry. Does this answer the brain cells is not regeneration, and how the stroke victim is can improve? We call neuroplasticity. It's quite lucky that our brain can be modified and relearning again. I want to compare like you play some sport. When you're born, when you grow up, if someone wants to tell you just play football, you can be expert. Can you? Cannot. We have to practice. We can play hula hoop when we was born, then we cannot do. I cannot do. But we can, if we practice again and again and again, the brain relearning and can do that activity. This is a concept of the rehabilitations. You repeat same activities again and again, and the brain is relearning. But the damaged brain maybe need a longer time for the normal brain. So for sport, you need a good technique. You have to need a coach for advise you how to do it. You have to need a good equipment for training. So shall I introduce a little bit about the facility in our hospital? The staff is not the real patients. Okay, so we start from the important thing. In my opinion, the important is the patient when the stroke attack, the patient just stay on the bed from the weakness. The most important thing is he need to stand to walk again, in my opinion. But so the walking is quite important. So we have some equipment. We show you some equipment for start to move the patient up from the bed, and for prevent complication from lying too long in the bed, like a tiltable. We have like a gate for some equipment for move the patient to stand up, strengthen the muscles, train the balance. And this is can connect to the computer for the program. You can play the game to move by the movement. You train the balance and enjoy with the game like that. This is can connect to the treadmill and help for the patients can start to walk like that. Okay, so it's a step by step, and it's a training by the physiotherapist to improve the balance if you have a better of the muscle strength. We have some patient needs some equipment for walking, like a walker and the cane. Okay, so not only the walking problem is not only the walking is a problem. It has like activity of daily living. He needs to eat, he needs to toilet, he needs to bathing, he needs to dressing. If the weakness have problems. So in the hospital we have like a simulation room, like build some facility like your home. Like we have a toilet, we have in like a bathroom, we have a kitchen. Okay, for have to train, the patient can train like a simulation when we back to home. Okay, we can. Some patient need to modify the equipment like a spoon, knife, because of a weakness of the muscles, contracture of the joint. He can use the special modified equipment. Okay, right. This is a sample that the patient simulation in our simulation room. Okay. And the swallowing is have one of the problem. Not only the arms and the leg muscle is weak, the pharynx and the oral muscle tongue can be weak. And when he eats something, want to drink something, sometimes it has some aspirations, and it's cause of pneumonia infection. The lung is very serious and cause of death. Okay, so we can do some stimulation of the muscles. We have some vertical stimulations. This is new technique for soaring training. Okay, so the rehab for the stroke rehab is not only one, not only me, not only the doctor, but we have a combined with the team. The team is like a doctor, nurse, physiotherapy, occupational therapy, speech, and psychology. And okay, so this is some question. So when should the stroke rehab begin? Usually it's early as we can. If the patient is stable, is no condition like the heart condition, like blood pressure is not too high or too low, it's not too the heart rate is not too quick, and it can be done. So mostly it's start at the first day or second day after the stroke, if the patient is stable. Okay, and the stroke, where is the stroke rehab can take. Okay, not only in the hospital. After the acute attack, the rehab can start in the hospital. But after that, you have to do like outpatients. You can take care in the nursing home, or you can continue the rehab in your home. Okay, how long does the stroke rehab last? And so it depends on the severity of the stroke. If the stroke attack is just only TIA, you do not need any rehabilitation. TIA means like a stroke attack and complete recovery within 24 hours, so you don't need any rehab. But if in my case, the stroke usually is very improving after the stroke attack about 4 to 6 weeks. But after that, they can going on improving more. I often to tell the patient the golden period is about 3 to 6 months after the stroke attack. This is a good time and very quick recovery if you have like good rehabilitations. After 6 months to 1 year, the patient can have some recovery but quite slow. After 1 year, it's not change much. But it depends on the stroke. If you have an ischemic stroke, the recovery is very, when compared to hemorrhage, the ischemic stroke is not quite good response the response is not as good as the hemorrhage. And so if you have a hemorrhagic stroke or bleeding, after 1 year or 2 years, you can have some recovery after training. Yeah. Okay, what is the outcome? Okay, so this is a factor of like physical, emotional. The physical we talked already, but emotional is important. Some cases not cooperate with the training. It's don't want to do, angry. It's a bad factor. Therapeutic is early is a better result. And the social factor. Okay, this is a communication. You have everyone is a friend. Okay, so the friend families can support the stroke victim. If he has a good friend, good families, this is a good factor for the recovery. Yeah. Okay, so Dr. Tanakorn talked already about the risk factor. So you can check this all of that. Okay, how many you have a risk factor? So, and how to prevent or how to decrease the risk factor? Okay, I get you some this one and like a take-home message. Okay, so the risk factor can be improved by the monitor your medications. If you have a problem with the diabetes, hypertension, this definitely you have to tight control. You need some medications for control your blood levels. And okay, and
just wait.
okay, and you check your environment. If you have like a risk for fall down, like too much step or ramp is too high, or you like a dark environment, you take a risk for accident and you can have injuries. Then you have to ensure your health diet. The diet is important. It can control the risk factor. Also, exercise can help for promote can control the exercise can control your risk factor, diabetes, hypertension, and it's good for your emotion also. Stress, decrease the stress and depression. And be careful if you have some disease or impair the balance, then you have to check. And you have social interactions and keep the brain active to play game, to do some activities, to enjoy your life. And you need some friend and family to support. And the last one is take care for yourself. Okay. All right. Thank you, everybody. Thank you.
Say that, come up with if you don't come.
Questions?
Doctor?
Yes.
Yeah, I've often heard that someone's been referred to as having a mini stroke. What exactly is that?
As I showed you slide, the stroke is just like a stroke that can happen and is recovered by itself. So the auxiliary name of it is a TIA, or the Transient Ischemic attack. So it's like the stroke happened and it get over by itself within a day. So then we call it a mini stroke. But the major stroke is stroke that happens, that will occur, it will not go away. Does that answer your question? Yeah. Well, how do we recognize this? That because of the symptoms of the mini stroke or the major stroke is the same. So it's like you have the simple stroke, you may have like a weakness on one side of the body, or you have numbness of one side of the body, or you have like a speech difficulty or unable to understand in language, including like a sudden severe dizziness or headache. But if the symptoms get recovered by itself, so it's going to be like a mini stroke. But if not get recovered, it's going to be the major stroke. The symptom is the same, but just different from the time.
Just to follow up on that same thing, on this transient or mini stroke, you said that you should treat it as an emergency, go to the hospital immediately. What is the hospital going to do for mini stroke if it's basically over when you get there?
Okay, well, the mini stroke can be get over by itself, but it maybe not go too fast. The timing of recovery can be minutes or hours, but the meaning of the mini stroke is the symptoms should be fully recovered within 24 hours. So that's like when you go to the hospital, you may have some remnants where some of the symptoms maybe persist. But because of the mini stroke, it's going to be the risk of the major stroke in the future. So the thing that we're going to do in hospital is we will check the risk factor. We will find out what the cause of the stroke this time. And then we can give the medication. We treat a mini stroke or a TIA as the same as stroke itself.
Yes, I've heard that table salt is really not all that bad for you, but it's the processed foods that really bring you down. What do you think about that?
Okay, but it's all right. Well, for the base idea for the how to control your salt is you cook by yourself, if you can. All right, because if you're cooking, if you can do cooking, so you can choose the ingredients, you can measure how much of the salt or the ingredients you're going to take into your food. For the amount of the salt that you can take per day is not more than 2 grams. 2 grams of the salt, 2 grams of sodium. So it will be calculated as 1 teaspoon of the salt, not more than this per day. So for the questions, how can you control the salt if you have to buy the food from restaurant, you go to eat in the restaurant, I can tell that it's maybe hard to control it. But maybe you can tell the cooker, or you can tell the chef about it. Okay, you are in control of the salt and make them less salty as possible. Okay.
I'm under the impression that rock salt was better than normal table salt. Rock salt.
Okay. Well, for the answer to these questions, I have to tell you because I'm not so expertise about on the type of salt. It's about myself, but I think it will be the dangers of the salt, or why the salt is to be dangerous to your health, is about the amount of salt inside. So if the rock salt have a less sodium than a table salt, okay, it will be more safer. But for the example, the answer to these questions, maybe I can. I'm sorry, I cannot answer to you directly.
Excellent talk, thank you so much. It was so incredibly thorough, and for you to give that as your first talk was amazing. I have a question. Again, I'm very interested in this transitory strokes, and I remember a couple of years ago, out of the blue, all of a sudden I just felt dizzy, right? And I lay down, and within about 20 seconds it was gone. I was with somebody, and they said, "Do you want to go to the hospital?" But it was like gone like that. Now, could that have been a TIA?
Okay. For dizziness, it's going to be like something a little bit vague, because the dizziness can cause by many factors or many causes. Mostly, it can be caused from the inner ear organ, just like like a mini disease or like a paroxysmal vertigo. But the symptoms can be give us an information to distinguish these two causes. Because if you got a very severe headache, with a severe dizziness with the spinning sensation, so that is going to be like, okay, the more severe of the dizziness is, it will be like a more benign form of the dizziness is. Stroke, the dizziness from the stroke is usually not so severe, but it will persist. So just like when you got dizziness or you got an imbalancing, if you come from in the ear, the symptoms can get better or improve when you take some rest. But for the imbalancing or the dizziness that come from stroke, your imbalancing will be persist in the same pattern. It will not go away. It may be a little improving, but not so much. So the thing is that the symptoms and the time and the severity of the symptom of the dizziness can make us information to discriminate these two symptoms.
Never mind, only one question. Okay. Great speech, by the way, and you did a good job for your first time. Thank you. For many, many years, whether I'm at the VA hospital or any hospital, when I go see the doctor, they always ask me two questions. And they said to me, are you taking your baby aspirin and my omega-3 fish pill? They ask me every time I go there. now I've seen recently that the baby aspirin is kind of getting a bad rap. Can you comment on that? Should I still keep the baby aspirin? Keep taking it? But is that for the blood thinning and stuff for the stroke? Is that correct?
Yes.
That helps.
Yes. It depends on what is the reason that you take the baby aspirin. The baby aspirin or the 28 milligrams or less than 28 milligrams of the aspirin can be benefit if you use it as a secondary prevention. This will be like it will be useful when you use it as a prevent of the next stroke. So if you really got a stroke and you take the aspirin to prevent the next episode, it will be helpful. But if you don't have a stroke and you take the aspirin as a primary prevention, the downside of the recently studied evidence is still to be uncertain about the benefit of the baby aspirin. Because the baby aspirin has been proved to prevent the heart attack, but not for the stroke. It may have some little bit benefit if the one who take is a woman who has like diabetes and hypertension. It maybe has some more benefit than a man. But as a total for the preventive stroke, if you take the aspirin as a first place to prevent the first time of stroke, it's maybe not so helpful.
Could you tell me, please, approximately how many brain cells you would expect to find in a healthy brain?
Okay. This depends on how much of the brain surface that you got, because it is so very individualized of the how many brain cells in your brain that you got. But normally, I'm not sure, but it may be about the 32 trillion cells in your brain every. But it not just like the one number, but many of cells in your brain. It depends on the person too.
Over to your left, please, Doctor. Doctor, over to your left.
Okay.
Good morning. I had a stroke or a mini stroke many years ago, over 20 years ago in Malaysia. I got dizzy one day and I had to sit down by the side of the road, and I suppose that was a warning, because the next day I collapsed and I had to be taken into Malaysia, Kuala Lumpur Hospital, which is not a very nice hospital actually. It was rather like our hospitals, some of them. And however, after 4 or 5 days I completely recovered. I thought the reason was I was not drinking enough water. I'd spent a month, I'd been in Australia, I'd been in Australia and walking around a lot. I'd been to Singapore, traveling a lot, and I wasn't drinking enough water, so I think that's one of the causes. And the other question is, well, not now too, but I was on statins ever since. Now, there are good and bad views on statins, and whether they're better than aspirin or not. Perhaps you can tell me about that.
Well, I have to clarify to you guys firstly. The aspirin we take the aspirin as a prevention, because the aspirin is used to anti the aggregation of your palate. So the aspirin will be helped to not cause a blocker. But the statin is used to reducing your cholesterol or your fat in your blood. So the statin will be helpful if the cause of the stroke is come from the deposits of the fatty particle to reversible. So that's like if you got a stroke or you have a mini stroke and you check and the result of your LDL or your cholesterol is more than normal range. So the statin is going to be having a benefit. So then, like these two medication has a different action to prevent the stroke. Is that answer your question?
Thank you.
Go ahead, Doctor. Did? Oh, okay, just one.
Just 2 comments. The human body, the average human body has about 37 trillion cells. To answer your brain question, the size of your brain uses a percentage of that. To make a comment on your processed foods, Salt is long and for probably thousands of years been used as a preservative. So when you got processed foods, you got a lot of salt in there just to preserve it. Look at the labels on any processed food and you're going to see a lot of sodium. So that's why processed foods are so bad for you, because there's salt in them. The average table salt's not bad as long as you're not putting it on processed foods.
There was another question.
Do you recommend taking a small aspirin for your heart? And could you also comment on his question about omega-3s?
Okay, the omega-3 is just like now is some form of omega-3 can be a medication to reduce some type of the fat, especially dry glycerine. The dry glycerine is one of the fat in your body that can cause some of the occlusion of your blood vessels. But the omega-3 is not like a first-line medication to use for treatment of the high level of your fat in your bloodstream. The statin is also the first-line treatment. So the omega-3 is can be like the supplementary or the adjunctive therapy for if you have the more competent or one medication cannot to reducing your blood vessel, your blood fat. But some people may take the omega-3 as a supplementary to reducing your keep your cholesterol lower or something like that. But I can tell you, if you can take that, it maybe have some benefit, but maybe not for the treatment, just like a supplementary adjunct.
Small aspirin for the heart.
But the small aspirin for the heart is a treatment because the aspirin will be given to the person who has got the risk factor or have the major risk factor of the cardiovascular disease. Just like you have hypertension, you have diabetes, you have the first degree of your family has a died or have a history of a heart attack before. So and your age is more than 50 years for the men and 55 years for the women. So all this this will be the risk that you can cause the heart attack in the future. So that's will be given. You have all these risks. But if you don't have all these risks, it may be not taken. Because if you take aspirin every day, if you have the pro and cons, the pro of aspirin can prevent the heart attack, but the cons it can cause a hole in the stomach.
Okay, I guess all right. My heart doctor is at your hospital there, and he did the blood work on me here about 3 months ago, and he said, I'm not eating enough salt. But the salt, he said, is that, somebody said rock salt, is that the same thing as the pink Himalayan salt? That's the way you talk about rock salt, right? Okay. Yeah. But he said, I'm not getting enough salt. Like, I'm kind of a vegetarian diet. I don't eat much of anything like that. Processed foods, I don't eat too much.
Okay. I think that for next sections, I will get some more information about the salt. Okay.
Obviously, we need a specialist talk just on salt. Tanya, this is Tanya who helps arrange the speakers from the Bangkok Hospital and does an absolutely fantastic job every time. Thank you, Tanya. Just quickly on that thing about the heart. What the doctor said about the stroke is what I just heard about the heart thing, is that the evidence is that taking an aspirin to prevent your first heart attack doesn't work so much, but if you've had one, then they recommend starting to take it, same as with the stroke, right? That's what I've heard. This isn't my question. My question was, I'm very interested, just lately I heard that in terms of physical health and heart, number one, diet, and it used to be number two, exercise, but now they're saying number one, diet, number two, sleep, and number three, exercise, because sleep is so incredibly important, including for the brain, because consciousness, being awake is like low-level brain damage that gets repaired. So I'm just wondering if you'd sort of support that in terms of strokes as well, diet, sleep, exercise.
Well, okay.
Just interested.
You mean like for the health, for the benefit to the brain, right? Okay. As I showed in the slide, that now we trying to focus on the risk. The first most important risk factor now is the blood pressure. If you have a high blood pressure, so now it means like your blood pressure is over 150, or your lower number is over than 80, you've got a high blood pressure. So the high blood pressure can be the number one risk factor nowadays. And then it can become like, and then it's with your diabetes. Your diabetes and your lung profile, these three of risk factors can be caused from the diet. So in my opinion, I still pay attention to diet as a first rank of the controllable risk factors, and then the exercise is to be the second one. For the sleeping, because the evidence is not so strong about the if you got the snoring or you have obstructions of your sleep during your sleeping, it can cause the further damage. Like it can cause the hallucination to your brain, and it can cause the further of the future stroke in the future. But the evidence of this is not so strong, because the last guideline from the Rehabilitation and Rehabilitation Association 2019, they also come out that the LSA is maybe not need to be screened in every patient who got a stroke. So in my opinion, the sleeping would be the last one. So I will rank it like a diet the first, exercise second, and sleeping the third.
Yes, Doctor. Very interesting talk. One of the easiest way of probably an indication of somebody who's possibly had a TIA is to ask them to close their eyes and then use the finger to hit the nose. And it's usually an indication that there's an interruption there. And the TIA is exactly what the doctor's saying. It's a warning. I would like to refer to Patricia Neil Wyman. In 1965, probably before your time, she had an indication of a TIA twice. Didn't take the warning because obviously there wasn't the knowledge in those days that you're imparting. And then she was hit with a massive stroke. Took her speech, took her arm, took her leg. This is a very active actress, and it was very tragic. Her husband, Dal, didn't give up on her. He spoke to her and talked to her for the first 24 hours. Friends stepped in. They got her into a swimming pool. She didn't want to do this, because you get very confused. And these friends exercised her, got her to do all sorts of crosswords, and she told them to, too many ladies here to use the right word, but in 1967, this actress who had this massive stroke walked onto a stage with 2,000 people and spoke, walked and everything, and started acting again. Now, it's not doom and gloom. You can recover from it, but it's essential what the doctor's saying. Those first hours are most important. I've dealt with them before, and what you do actually helps the doctor straight away. So, look at your friends and see if he's brain dead.
Thank you. Thank you for your help, you guys. Okay. Any more questions?
Over to your left, please, Doctor.
Okay.
Yes, good morning, Doctor. Is there any evidence between the association between strokes and marriage?
ability to walk.